Good morning, everybody. Good morning, everybody. Oh, so much better. I appreciate the greeting. Thank you so much. Permit me to recognize the presence of the Honorable Dr. Irvin McIntyre, the Minister for Health, Wellness, and New Health Investment, Dr. Carissa Etienne, Director of the Pan American Health Organization and World Health Organization, Permanent Secretary acting in the Ministry of Health, Wellness, and New Health Investment, Mrs. Letitia Lestrade-Wyke, representatives of other permanent secretaries, Dr. Merle Lewis, Chief of Staff, Office of the Director of PAHO and WHO, Dr. Amalia Del Rigo, who is the PAHO WHO representative to Barbados and the Eastern Caribbean countries, Dr. Andy Patterson, Advisor, Health Systems Services, Ms. Annick Wilson, PAHO Country Program Specialist for Dominica, other staff of the Pan American Health Organization, Dr. Laura Esprit, Chief Medical Officer Acting, other core managers within the Ministry of Health, Wellness, and New Health Investment, other staff of the Ministry of Health, Wellness, and New Health Investment. We welcome as well representatives of the various governmental, non-governmental, and private sector health-related stakeholders, other invited guests or media partners, those of you listening and viewing, good morning once again. We are very grateful that you have made the time to be here this morning as we open a week of activity to hallmark this project that is a collaboration between the Ministry of Health, Wellness, and New Health Investment, and of course, our distinguished and very capable partner, PAHO. Of course, this is the in-country stakeholders engagement for advancing the Dominica health system's transformation to achieve universal health. And I'd like to, first of all this morning, welcome to the podium our Permanent Secretary to do the official welcome this morning.
Thank you, Ms. Harry. I recognize the presence of Honorable Dr. Irvin McIntyre, Minister for Health, Wellness, and New Health Investment, Dr. Carissa Etienne, Director of Pan American Health Organization and World Health Organization, Dr. Amalia Del Rigo, PAHO WHO representative to Barbados and the Eastern Caribbean countries, Dr. Andy Patterson, Advisor, Health System Services, Ms. Annick Wilson, PAHO Country Program Specialist for Dominica, other staff of the Pan American Health Organization, Dr. Laura Esprit, the Chief Medical Officer Acting, other core managers of the Ministry of Health, Wellness, and New Health Investment, and staff of the Ministry of Health, representatives of the various governmental, non-governmental, and private sector health-related stakeholders, other invited guests, the media, ladies and gentlemen, and our moderator, Ms. Sheena Harry. The Ministry of Health, Wellness, and New Health Investment has the overall responsibility of developing and promoting health services in the Commonwealth of Dominica. This we have been doing using a collaborative approach with various stakeholders while keeping abreast with current standards of international practice. Today, we have brought together stakeholders across the Dominica's health-related landscape as we set the stage in conjunction with the Pan American Health Organization, PAHO, for upgrading the National Strategic Plan for Health and the commitment to the spectrum of activities of the project advancing the Dominica health system's transformation to achieve universal health. On behalf of the Ministry of Health, Wellness, and New Health Investment, I extend a special welcome to all those who have graced us with their presence, especially our Honorable Minister for Health. An extra special welcome to the PAHO WHO Director, Dr. Carissa Etienne, the PAHO WHO representative of Barbados and the ECC, Dr. Amalia, and all other representatives of PAHO who are present and who will help facilitate our sessions throughout the week. We appreciate the support that you have been giving and look forward to a successful week's activity. This morning's session, which is the opening event, Energizing All for Action, will set the stage for upgrading the National Strategic Plan for Health. And we believe that you, the representatives of the wider governmental and non-governmental, as well as the private sector, can play a significant role in this regard. The strategic plan for health, which is being reviewed this week as part of the activities for advancing Dominica's health systems transformation, was for the period 2010-2019. Unfortunately, the COVID pandemic created a setback for us, and so I am pleased that we will be completing the review during this week. Once again, I bid a warm welcome to all, and thank you for your support thus far. Thank you.
Thank you so much to the Permanent Secretary, Mrs. Letitia Lestrade-Wyke. And as she mentioned in her welcome, transforming healthcare is now not just a Ministry of Health responsibility, but a collaborative effort. And that's why we have many of our stakeholders here from both the other governmental agencies and the private sector especially. So we'd like to welcome them in a particular way. And we look forward to working with you throughout the week. Of course, in order to understand what will be happening this week, we invite Dr. Amalia Del Rego to give the overview of the project.
Thank you, Madam Moderator. Good morning, everyone. I want to recognize the Honorable Dr. Evelyn McIntyre, Minister of Health, Wellness, and New Health Investment. Our dear Director, Dr. Carissa Etienne, who is with us today. The Permanent Secretary, Acting Ministry of Health, Wellness, and New Health Investment, Letitia Lestrade-Wyke. Dr. Andy Partazin, Advisor Health Systems and Services of the PAHO Barbados and ECC Office, Ms. Anik Wilson, PAHO Country Program Specialist, Dominica, who is not stranger to you. Other staff of the Pan American Health Organization, Dr. Laura Spreed, Chief Medical Officer Acting, other core managers of the Ministry of Health, Wellness, and New Health Investment, other staff of the Ministry of Health, Wellness, and New Health Investment, representatives of the various governmental, non-governmental, and private sector health-related stakeholders, other invited guests, the media, ladies and gentlemen, good morning, everyone. I think I want to start by sharing with you how delighted I am to be back in Dominica the second time this year. And today, in my new capacity as a PAHO WHO representative, your PAHO WHO representative, I want to say that it is a moment for me to also thank the government of Dominica for welcoming me as the new PAHO representative. So I am very appreciative of that. Also to take this opportunity to reaffirm PAHO's commitment to work hand in hand with the government of Dominica to make sure that the health systems transformations that are needed to advance towards universal health for all Dominicans are achieved. And in that regard, you cannot have today in this week a better manifestation of that commitment by having with you a very strong team at the moment, led by our director herself, who is here with us. Thank you, Dr. Etienne, for being giving that type of support. But also, this week, we will have a team that is comprised by both staff from the PAHO Barbados office and also staff from Washington headquarters. Dr. Anselm Hennis, our director of NCDs and mental health, will join this afternoon. Dr. Jonas Gonzet, advisor on quality of healthcare, will join also this afternoon. And of course, I have mentioned already Andy, Anik, and myself in this week of activities. The main objective of this week, and I think it speaks to also the objective of the Health System Transformation Project, is basically to advance towards universal health. And as you know, universal access to health and universal health coverage will need necessarily a very strong, well-organized, well-financed, well-resourced health system. And it also needs a lot of transformations to make sure that we apply lessons learned, including from the recent experience of dealing with the major pandemic of our century. So that is what this project is about. The project intends to facilitate concurrent work in at least 4 important areas of work that have been identified. Putting people on the center, then that means the first thing that we need to do is to make sure that services are organized to meet the needs of the population. And we talk about not only the specific health services, but also an approach that will be inclusive of addressing the social determinants of health. In our PAHO belief, and I think it's also the belief here in Dominica, is that it is only by implementing a primary healthcare approach to guide the transformation of the health systems that we will really achieve those milestones. So the project has 4 important areas of focus. First one is to improve quality and access to quality primary healthcare services with focus on NCDs and other health conditions, priority health conditions, but implementing in that approach, revamping what is really the basis of primary health care, community engagement, community participation, and the engagement of all multiple stakeholders to really achieve quality primary care services. The second component, of course, is giving attention to the hospital authority and the hospital services, as we know that for comprehensive care and to ensure the continuity of care, we need both primary care and hospitals to be well coordinated to ensure that the health network can facilitate that continuous quality care that everyone will need. So the second component of the project is really emphasizing the support to improve hospital care, but also to improve coordination between hospital care and primary care services. The third component, and not because it's the third, is the least important, is to strengthen the Ministry of Health capacity for leadership, stewardship, and governance, and that means the health authority, because either primary care services or hospital services are not going to function well without a strong national health authority. And in that component, this week is extremely important because one of the elements that is needed to achieve and to facilitate that stewardship and governance is to have a good understanding of the direction for health, and that will mean a strategic plan, a health strategic plan that can clearly identify the vision, the direction, the targets, and that is shared with the key stakeholders to move on. So that third component of the project speaks to the strengthening the National Health Authority. Embedded in that, the component of health financing. Because if we don't have a financing mechanism to ensure that all of this will take place, as you know, is going to be difficult to advance. So that component is the third component. And the fourth is the strengthening of the health information systems for health and moving toward what we call the digital transformation of the health systems. Because with technology now available to facilitate the organization of care and access to health services, we can really move ahead very rapidly. So those are the 4 core components of this project. We will be touching upon several of them this week. And for us, it's really a privilege to be here with you in the Nature Island. I think I'm looking forward to a very productive week. And again, you can be reassured of PAHO commitment to move along with this process and continue to work in hand with the Ministry of Health and the government of Dominica to make this a reality, and that is that all Dominicans have access to the quality health services they need on a timely manner and in a way that it will not really create any financial burden in the population. So thank you, and looking forward for a productive week. Thank you very much.
Thank you so much, Dr. Amalia. Dr. Amalia, in as much as you're excited to be here, we're even more excited to have you back here. And I believe that twice in a year is testimony to your commitment and dedication to the improvement of our health system in Dominica. So thank you for your willingness to visit us again. Of course, and we're also happy to have the next presenter here. She is a daughter of the soil, so we expect her home very often. However, we are very happy that in her capacity as the director, she has decided to grace Dominica with her presence once again. So I invite Dr. Carissa Etienne, director of the Pan American Health Organization and World Health Organization, to offer brief remarks.
Thank you, and good morning again. Let me start off by saying that it is indeed a pleasure to be home. I must confess that I came for the celebrations, but Amalia has made me stay and to be here for this event, which I think is a very important event, and that is why I said yes. But before I start, let me also send my condolences to the government of the Commonwealth of Dominica and the peoples of Dominica on the recent loss of life and the destruction caused by the floods, the recent floods, and to assure you that if anything is required, that PAHO stands by, and we are already in contact with the officials here to see if there's anything that PAHO can do to help relieve some of the pain and suffering. Certainly, this is something that Dominica faces over and over again. Let me say also, and thank those of you who are here, not merely from the health sector, but from the other sectors. There is no way you can plan the transformation of health care, health services towards universal health if across the board all sectors are involved. This is not a government activity. It may be led by the government, but this is an activity for all peoples of Dominica. And if there is anything that we have learned from COVID, is that we need across-the-board engagement to ensure that we have health systems that meet the needs of the people. This is not new to Dominica. As early as 1980-81, and the plans that followed, we always had multi-sectoral engagement. In the development of the plans, we had workshops of 200 people sitting and deliberating on initially and towards the end on the plans and giving their suggestions. We must learn how to capture the pearls of our history, those lessons that we've learned over time, and bring them forward and apply them as we continue our work. You know, we are all faced with one constant, and that constant is change, and the need to transform ourselves, our lives, our systems, to meet our evolving needs and the context. COVID-19 impacted the life and the health landscape here in Dominica, as in all countries, and to varying degrees. We have seen loved ones battle with COVID-19, Some are no longer with us. Health facilities were expanded or folded. New facilities for treating and testing sites were incorporated in Dominica, but certainly in other countries as well. Health workers and systems were stretched and stressed to their limits. Many lessons from COVID-19 have been chronicled, and these, together with the well-established basic principles on healthcare, health and well-being, constitute a fundamental framework for achieving resilience in health and universal health and SDG 3. We need to keep these tenets, the experiences, and the memories close to our heart as we move forward. They are to remind us of why we come together time and time again to strategize and take action. It is for our people, our health, and our nation's wealth. When we met in April of this year, our focus was on defining a way forward for the continued development of the Dominica Hospital Authority, strengthening it to provide a comprehensive set of hospital services that meet international standards and norms, delivered by dedicated, committed, and well-qualified health professionals. Since then, and with the support of PAHO, the Dominica Hospital Authority has begun a journey under the guidance of Accreditation Canada towards delivering quality health care to the people of Dominica. Work is also ongoing to complete the strategic plan for the Dominica Hospital Authority, which will provide the authority with the necessary frame for achieving all that is within its charge. But today at this event, we come together with a broader agenda, striving to shift the perspective towards the ultimate goal of universal health for all Dominicans, leaving no one behind. Two important concepts are included under this umbrella: universal access to health and universal health coverage. When actioned together, they seek to ensure that all people and communities across Dominica have access without any kind of discrimination to comprehensive, appropriate, timely, quality health services based on health needs, as well as access to safe, effective, and affordable quality medicines, while ensuring that the use of such services does not expose users to financial difficulties. And I think in Dominica we need to underline this last part. Furthermore, universal health implies that all people have access to the social determinants of health, and these include access to safe water and sanitation, universal education, proper nutrition, safe, adequate housing, safe work, healthy neighborhoods and environments, among others. This is not an easy goal to achieve, but what I do know is that all Dominicans must work together if we are to get there. Reminding ourselves of the breadth and depth of what health is sits at the heart of the work that is ahead of you. Health is not synonymous with what happens in a health facility. It is also not only about the absence of disease. Health is about where we live, how we play, how we pray, how we work, how we shop, etc. Our individual health is not absolute, nor is it a thing that once achieved remains permanent. We must constantly work at achieving health. And it is therefore for these reasons that we have come together as a diverse group. And I know that many are listening to us also in the media. You will each have the opportunity along the road ahead to contribute to the conceptualization of what is health from the Dominican perspective, and then to translate that conceptualization to collective and concerted action. This working in concert is not new to Dominica. We did so years ago when we came together and collaborated with stakeholders from communities across all corners, with social services and health practitioners, to shape a comprehensive set of health services from primary care to hospital level. In recognizing the presence of the Honorable Minister of Health, who is here with us today, and notwithstanding the announcement of yesterday, we must also stress the importance of the authorities listening, of them ensuring inclusion and tolerance, that everyone will be heard and every contribution will be respected. This is an opportunity to collectively deliberate and define a way forward for the transformation of the health system for achieving universal health. This is not the sole purview of the government or the Prime Minister. Every citizen has the equal responsibility to ensure that health systems are transformed in a manner that meets the needs of the particular community and the country. Ladies and gentlemen, a health system transformation agenda is simply not possible without the leadership of the National Health Authority. The most important determinant of success is the strengthening of the Ministry of Health's capacity for governance, for stewardship, and public health. In addition, the transformation of the health system in Dominica will require updating its organizational structure and improvement of capacities of the Ministry of Health to strengthen its stewardship and leadership functions, to build resilience, and to meet new functions and expanded responsibilities, including those related to the essential public health functions, epidemiological assessment and surveillance, NCD care and management, and information systems for health. They must be willing also to address international health regulations and disaster preparedness and response, human resource planning and development, health financing, and most importantly, the improvement of the management of primary healthcare services coordinated with the Dominica Hospital Authority, and building the trust and participation of people, communities, and families across the island in a well-organized, structured, and financed health system based on primary health care. Fundamental to this process of transformation is the updating of the National Strategic Plan for Health. On Wednesday, this November 9th, and Thursday, the Ministry of Health, Wellness, and New Health Investment, that ministry still exists, I don't think, will set the foundation for the strategic approach that will guide you towards achieving and sustaining the health of all Dominicans. Under the leadership of the Minister of Health, stakeholders will come together to underline the vision, mission, priority dimensions, issues, and health-related areas for attention over the coming next 5 years. This is an exciting time, and I hope you do feel that level of excitement that you across the country, and I hope it's not just those gathered in this room, I hope we take it to the communities, because it is they who are the beneficiaries, and so they must be involved in the actual planning process. But this is an exciting time, and therefore you are all urged to embrace it with energy and enthusiasm. We must be sure to integrate the health gains, the experiences gathered, and the lessons learned over the years with our work in primary health care. And it is through keeping a clear focus on primary health care that Dominica and its people will be best positioned to face the health-related challenges of the future. To this end, the Dominica Health System transformation is designed to be grounded in the values, principles, and the practical application of the primary healthcare approach. That means putting people at the very center of all of our actions. This transformative path is not about me It is not about the Minister of Health. It's not about Amalia. It's not about the person speaking at this podium. It is about everyone pulling together, building the vision for a healthy Dominica. We are all aware of the challenges ahead and the evolving global stage that is ultimately impacting the determinants of health. But let me assure you that you in Dominica, you are not alone. I continue to express my own commitment and that of the director-elect of the Pan American Health Organization that PAHO will stand with you on this exciting journey to shape the future health and well-being of all Dominicans, leaving no one behind. I hope I can join in the process when I return to my position as a Dominican. I want to wish you an exciting and successful journey, and thank you so very much for taking on this task.
Thank you so much, Dr. Carissa Etienne. I don't know when her Dominican ship was revoked, but whoever did that, give it back to her, please. Please. All right. And like Dr. Etienne mentioned, no system is perfect. But the first step to recovery is to acknowledge that there are shortcomings. So that's what this week is all about, to focus on where we are not doing the best. While we rejoice in all of our strengths, but it's important to recognize where we're not doing our best and where we can improve. So thank you again all for your willingness to participate. And with our feature address this morning, I'd like to welcome the Honorable Minister for Health, Wellness and the New Health Investment, Dr. Irvin McIntyre.
Okay, thank you, Ms. Harry. Let me first recognize Dr. Carissa Etienne, Director of PAHO, WHO, Permanent Secretary, Acting Minister of Health, Wellness and Health Investment, Mr. Letitia Lestrade-Wyke, Dr. Amalia Del Riego, PAHO WHO Representative to Barbados and the Eastern Caribbean countries, Dr. Andy Pattersing, Advisor, Health Systems Services, Ms. Annick Wilson, PAHO Country Program Specialist, Dominica, other staff of Pan American Health Organization, Dr. Laura Esprit, Chief Medical Officer Acting, other co-managers of the Ministry of Health, Wellness and New Health Investment, other staff of the Ministry of Health, Wellness and New Health Investment, representatives of the various government, non-governmental and private sector health-related stakeholders, other invited guests, the media, ladies and gentlemen, pleasant good morning to everyone gathered here today. Well, it's really my pleasure to be here this morning for this engagement for the Advancing the Dominica Health System's transformation to achieve universal health. And I must say this is a great opportunity for us. We have to consider ourselves fortunate that we have such an opportunity that we can have such an engagement with different stakeholders so that we can see the advancement of our health system. We have to recognize that after coming from COVID-19, which taught us quite a bit of things, not only us in a developing country, but even developed countries, they faced the brunt of it, and it was always those at the lower end of the scale, it was always those at the lower end of the bottom, it was always the unfortunate ones who suffered the most. And that taught us great lessons. It also taught the developed countries, but for us in small island developing states, it was even more significant for us. And also, we have to look at the other changes in terms of chronic non-communicable diseases, which is affecting us, well, it affects the entire world, but us as a small island developing state with limited resources, it even becomes even more relevant and significant that we tackle these problems. Let alone the pandemic, let alone the CNCDs, we have to also recognize the problems that we face due to climate change. As a matter of fact, just a couple of weeks ago, the OAS had a massive conference at Kempinski when we were addressing the resilience in health, because we recognize that climate change is going to pose many different problems for us as time goes along. So we might as well get prepared, and our resilience is not just in terms of infrastructure, but our resilience has to be in terms of our health. and our whole mental attitude and our approach. So, and then considering the fact that in advancements and technology and the digital economy, we also have to consider the fact that we have to advance the technology in health, so that's where the telehealth aspect comes in. So as the speakers before me mentioned, primary health care, the Dominica Hospital Authority, the Stewardship and Leadership Ministry of Health, and also the telehealth, which are the four main components of this engagement we're going to be going through over the next 4 days. So with all of these that I've mentioned, obviously the term that you've been hearing a lot from since last night is reset. So here we are in the Ministry of Health, and we're going to reset as well. This is the bottom line. So this is the engagement, and this is the reset button that we're pressing here in the Ministry of Health as well. Now, and we recognize that it has to be done from the foundation. So this is why primary health care is number one, as we mentioned, on the list of things to be done. And you recognize that the government has also invested quite a bit in primary health care with all the infrastructure that we've set up and we continue to set up. But there are other aspects within the health system that the government is playing a major role, whether it's in terms of human resource, which I'll talk about later, and also in the digital economy, which we'll mention later as well. But that is because as a government, we recognize that for our development, we need a healthy, productive population. This is the foundation. So granted, the same way we can say the primary health care is the foundation of health, we have to say the foundation of our development as an island state, small island developing state, is a healthy, productive people. And the government is fully aware of that, and that is why we have invested so much in healthcare. And you have to recognize, as Dr. Chen mentioned, it's a multi-sectoral approach, and we are fully aware of that. To start from the top, in terms of political will, we have a government, we have a leader that is, well, from a health background as well, and the political will is not lacking on our government side. Every single one of us in cabinet, we are fully aware of the significance of this, starting from the Prime Minister down, and we are very determined and we are committed to provide the health services to the population of this country. And we know that it has to be all the departments of government. So for instance, the Ministry of Agriculture is on board in terms of healthy food production. The Ministry of Education is on board because we know we have to deal with the human resource. So as a matter of fact, our farm tech program at the State College, we want to bring it to a BSc in pharmacology. And we also want to introduce a medical lab technology program at our Dominica State College coming September 2023. And these are, and also the scrub tech programs and all the OT programs. So all these are the programs at the Dominica State College, the Faculty of Health, which is to deal with the human resource for health, besides the fact of getting our doctors trained in Cuba and China and all over the world. Apart from that, the Ministry of Community Development, because we recognize that all groups must be on board. So whether it's sports groups, whether it's church groups, whether it's farmers groups and other agricultural groups, they have to be on board with us. We cannot do it alone in the Ministry of Health. So even the Ministry of Community Development is on board. Then addressing the social determinants of health, the Ministry of Housing, we also have, because that is all part of producing an environment and empowering people so that they can get a better state of health. And we also have to consider even water. We have 98% pipe-borne water. But all these are the things that the government is addressing, and we cannot just see health in isolation, but the other departments are also playing part. Whether it's the Ministry of Trade, as to what we import, as to the taxations, whether it's the legislation, whether it's on tobacco, whether it's on sweetened beverages. So you have to look at all these different trees and recognize that they make up a forest. And that forest is to provide a healthy population for the development of Dominica. So I think this is a great opportunity for us. We have to go head on, we have to grab it. I think we have to consider ourselves very fortunate that we have the director of PAHO, we have our Eastern Caribbean representative, we have other heads of PAHO, Dr. Luce will be here with us, Dr. Henson will be here with us, and you can recognize the sort of the energy they have come with. So we as the local stakeholders here, we have to have the passion. Not everyone gets those opportunities. This is the time we set in the reset button. We have to get together, we have to have the passion, we cannot let this opportunity pass us by. Long back, we knew what primary health care meant to us, and now we come full circle again and we come back and it's primary health care again. It's something we've known in the past. Let us just focus on it, let us just use the opportunity wise, let us get some passion into it, and let us bring the community into it, because we cannot do it alone. The community must be part of it with us. But I think, and not I think, but I know together we can do it. I'm very optimistic. I'm really looking forward to this. And I just want to thank all of you for coming here this morning. Let's have a very productive next 4 days. And we really thank the Pan American Health Organization. They have been here with us all throughout. They're here with us again. It shows their commitment. It's us now to play our part. And let's have some passion. Let's do it together. Let's put our little differences aside, put our little egos aside, and let's put Dominica first. I thank you so much.
Thanks very much, Dr. McIntyre. And in as much as we're hitting the reset button, I think I can speak for Dominica on a whole when we say we've been very fortunate to have you at the helm of this ministry for the past few years, given all the daunting experiences that we've had, COVID-19, right after being hit by Hurricane Maria. So, Dr. Mack, we are very appreciative of the work that you have put in so far, and we look forward to continued work with you. The vote of thanks. It may seem like a simple task. It always seems like the simplest part of the program, but sometimes not so much, because everybody's afraid that they forget somebody. So I'm glad Dr. Esprit is the one who's giving the vote of thanks, and I welcome her to the podium.
All right. To the Honorable Dr. Irvin McIntyre, our Minister for Health, Wellness, and New Health Investment. Dr. Carissa Etienne, Director of PAHO. We have our Permanent Secretary in the Ministry of Health, Mrs. Letitia Lestrade-Wyke. Representatives of permanent secretaries who are here. Dr. Merle Lewis, Chief of Staff of the Office of the Director of PAHO. Dr. Amalia De Riego, the PAHO WHO representative to Barbados and the Eastern Caribbean countries. We have Dr. Andy Partasingh, our advisor to Health System Services, Ms. Annick Wilson, of course, PAHO CPS in Dominica, other staff of PAHO, co-managers and staff of the Ministry of Health, Wellness and New Health Investment, representatives of the various governmental, non-governmental, and private sector health-related stakeholders, our invited guests, the media, our moderator. Ladies and gentlemen, good morning, and I'm a bit breathless saying all of that. All right, well, we have had a very concise and brief ceremony this morning, but certainly the length of the ceremony has no bearing on the meaningfulness and extent of what the project represents and the potential impact on clients, the Ministry of Health, and by extension, Dominica. There is no question that Dominica's health system has been tested over the years. Alongside the consequences of climate change, emerging and re-emerging diseases, inclusive of the COVID-19 pandemic, the health sector itself has gone through various challenges, including having significant human resource constraints and, of course, limited financial resources. However, I am sure that we are all in agreement that this is the opportune time for advancing the Dominica health system's transformation to achieve universal health. We can boast of so many things happening, and it's quite extraordinary times to be in health. From the implementation of a new Dominica Hospitals Authority to the digitalization of the health system, to re-strategizing our approach to chronic diseases and rebranding primary healthcare services. It truly is exciting times, one that calls for collaboration and for pausing, reflecting, and here goes the word, resetting our priorities. So on that note, special thanks must be highlighted to a few persons or groups of persons. And we'll start off with the Ministry of Health, or the administration in particular, and by extension, the government of Dominica, for having the foresight, the vision, the stewardship to revolutionize the health sector in an effort to benefit its end users. We also recognize the significant contribution of the Pan American Health Organization for their commitment to provide the needed technical support to Dominica, and of course their willingness to see this project to fruition. Certainly, PAHO's track record over the years puts us at ease that your experts will see this project, like many others, to the end. The presence and leadership of persons at the head table, just for being here this morning, despite your very busy schedules, ensuring that your remarks were geared to sow positivity, enthusiasm, to capture interest, and most of all, to trigger a movement to transform the health system of our country. Dr. Etienne, it's always a distinguished pleasure to have you home and benefiting from your guidance and direction. The astute role and continued leadership that you play in Dominica's development cannot be overemphasized. Dr. Amalia, we welcome you to the Nature Isle of Dominica. Of course, as was mentioned, 2 visits per year almost makes Dominica your second home. All right? So certainly we appreciate the position that you will assume in this timely project. To the heads of department in the Ministry of Health for providing your unwavering support to this project. And your presence here this morning is an indication of your commitment to the task at hand. And there is no doubt that this stakeholders consultation will be seen as the gateway to an evolving and dynamic health sector. All hands on deck are indeed needed, and we look forward to the various personnel with your unique skill set spearheading this project to the finish line. To all our invited guests from both the public and private sectors, including our NGOs, your presence here is by no mistake. We recognize that we cannot confront this task of improving the health sector in isolation, and this is a call to have the involvement of all. Hence, the ministry is aware that you have a very critical role to play in this transformation, and your active engagement and participation is vital to the success of this project, which has a direct bearing or potential to affect every citizen and resident in this country. This is your opportunity to contribute meaningfully and to assist in charting a new pathway for the health sector in Dominica, so please embrace it. To the media, your role cannot be underscored in disseminating vital information to the public, especially on matters that affect their health and well-being. And of course, to the listening public for paying attention and embracing matters of national interest, which can have a positive and direct impact on your health and that of your family and wider community. We are making things better for you. Just to end, a dictionary defined transformation as having a marked change in form, nature, or appearance. This marked change for the health sector means that Dominicans would have improved universal access and coverage to quality health services in a timely manner with decreased financial burden, where all are expected to benefit. As such, let's all embrace this renewed and dynamic health investment, which marks a momentous journey in Dominica's history. Thank you.
And with that, I'm sure you understand why I was glad that Dr. Esprit is the one who's doing the vote of thanks. Thank you so much, Dr. Esprit, who happens to be the acting Chief Medical Officer. And that takes us to the end of our ceremony for this morning. Again, on behalf of the entire ministry and the Pan American Health Organization, thank you for your attendance. And we invite you to continue to work with us collaboratively throughout the week as we work to accomplish this monumental task before us. This project is very important, as all of the speakers have said. So we ask that you continue to, like Dr. Mack said, to give that passion, put a little fire, a little pep in your step, and let us make this project a successful one. So thank you all once again, our media partners. Thank you so much for coming through, and have a good day, everybody.